Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. For those of you joining us today, just a reminder that the first portion of our briefing will be in English, and then we'll transition to the Spanish language portion of our briefing. Media questions are welcome during both portions of those briefings. And at this point, I'll hand it over to Mayor Barrett to get us started today.
Well, thank you very much, Catherine. We all recognize over the last 18 months, this has been a very trying period for Milwaukee, for Wisconsin, for the nation, and for the world. But yesterday, I felt was a very significant day. And the reason it was so significant is the announcement by the FDA giving formal approval of the Pfizer vaccine. Obviously, for the last almost 9 months, it has been used, but it has not gotten the full formal approval. And I think for a number of individuals, the fact that it had not received that formal approval was one of the reasons that they were hesitant to get the shot. But now, moving forward, I want to share that moving forward, as I said, COVID-19 vaccinations will be required for general city of Milwaukee employees, given the FDA's actions yesterday. We're doing this because we have an obligation to provide a safe workplace for all of our employees, and a vaccinated workforce is part of that. A vaccinated workforce also helps protect members of the public who interact with employees, as well as family members of city employees. This decision follows comprehensive reviews by both the Health Department and our Department of Employee Relations, and is a new requirement for general city employees effective September 1st. As of now, vaccination requirements do not apply to union represented employees, which specifically means public safety employees. We will obviously be working with the representatives of the public safety employees who remain unionized so that we can make sure we're doing everything we can to have all of those employees vaccinated as well. The provisions also exist for employees requesting exemption due to specific medical or religious criteria. Unvaccinated employees will have until October 29th to produce proof of vaccination. Employees who do not comply with these requirements will face an initial unpaid suspension for up to 30 days, and continued failure to comply will result in separation from employment. Again, this is being done out of an abundance of caution and concern for our employees and for the public. This is the right thing to do to help us end this pandemic. Employees can access their vaccination record online in the Wisconsin Immunization Registry by going to dhfswir.org or selecting Public Immunization Record Access. City employees will receive up to 2 hours of paid leave to receive vaccinations. They can do so through a healthcare provider, a local pharmacy, or at one of the Milwaukee Health Department's community or mobile clinics. The Northwest Health Center, located at 7630 West Mill Road, and at the Southside Health Center, located at 1639 South 23rd Street, are both open for vaccinations on Monday and Fridays from 9 a.m. to 3 p.m., Tuesdays and Thursdays from noon to 6 p.m., and Saturdays from 9 a.m. to 1 p.m. Additionally, the Health Department will host vaccination clinics for city employees at various locations. Hours and locations of the vaccination clinics will be provided in coming days. I think what you're seeing here at the city is an example of what you're seeing locally and throughout the nation, as more and more employers, both public and private, are now determined to do everything we can from a safety standpoint and a health standpoint to end this pandemic. And the reason is because we know that this continues to be a serious problem for all of our communities. And with that, I want to segue to our gating metrics so that we understand how this continues to be a serious issue. We remain in the extreme transmission category for COVID cases per 100,000 at 225 per 100,000. That is way too high. It's concerning. And we don't know what direction this is going to go as we get into the autumn months. Our percent positivity rate remains in the substantial transmission category, down to 9.2%. Again, still, from my standpoint, too high a transmission rate. In the city of Milwaukee, 52.5% of city of Milwaukee adults, that means individuals 16 or older, are fully vaccinated, and 57.7% of adults have received at least one dose. In order to push the needle on these metrics, we need people to get vaccinated, wear masks, and watch their distance. Vaccine is free, it is readily available, and proven now to be safe and effective in fighting COVID-19. Let's do all that we can to get these numbers back down to our lowest categories and keep one another safe. And with that, I'm going to turn it over to County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Mayor Barrett, and good afternoon to everybody joining us. First and foremost, I want to applaud the city's decision to mandate the vaccine for its employees. We know that the vaccine is the best tool that we have to get out of this pandemic. And with the surge in cases from the Delta variant, both public and private sector actions like this will be critical in mitigating the spread of COVID-19 throughout our entire community. And so over the past few weeks, I have been working with our county board, as well as county leaders, including our Chief Health Policy Advisor, Dr. Weston, to interpret the COVID-19 data and evaluate various policy options to increase vaccination rates, particularly among our workforce, that will help protect both the public as well as our staff. And a vaccine mandate for Milwaukee County employees is not off the table. We are considering all our options. And so our employees, work with some of the most vulnerable populations across the county in this community that have been disproportionately impacted by this pandemic. And so vaccinations is the utmost importance to us. But I also want to thank Governor Evers for announcing yesterday that the state will be providing a $100 gift card to Wisconsinites who received the very first dose of the COVID-19 vaccine from a Wisconsin provider between August 20th to September 6th. So residents ages 12 and older are eligible for this reward. And in order to receive the $100 Visa gift card, Wisconsin residents will need to fill out a form, which is available at 100.wisconsin.gov. You can find information on the reward program by visiting the DHS website, but you can also call 844-684-1064. Again, that number is 844-684-1064 for more information about the reward program, and language assistance is available. But also, in addition to getting vaccinated, we know that masking, this is another important mitigation tool that we have. And the TSA just recently extended a federal mandate of masks on all public transportation networks throughout this nation. And so the federal requirement supersedes any local or state mask policies that are out there. And so passengers and employees are required to wear masks while on board all of our buses, commuter trains, commercial aircraft, and airports, regardless of your vaccination status, through at least January 18th, 2022. And since the start of the COVID-19 pandemic, the Milwaukee County Transit System has worked tirelessly to keep passengers and employees safe while still offering an essential transit service that many in this community depend on. And so we will do our part to keep these employees safe by getting vaccinated and following best health practices, including wearing a mask while using our county transit system services. So if you would like more information about our Milwaukee County Transit System related to coronavirus, please visit ridemcts.com/coronavirus. Again, thank you for all of you joining us this afternoon. And with that, I'll hand it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 254 new cases per day and about 2 deaths per day. Now, our cases seem to have plateaued. We've been around 250 cases per day for about 3 weeks at this point. It's not going down, it's not going up. But given national trends and back to school looming, we should be cautious that this may be a momentary pause in our rise in cases. Meanwhile, COVID hospitalizations continue to rise. We're now at 229 people in our hospitals in Milwaukee County. That's our highest number since mid-January. The big news, of course, is FDA's full approval of the Pfizer COVID vaccine. This is such a critical step toward instilling vaccine confidence. I still often hear from people with questions about the vaccine, with hesitations as to whether they should get it. Now look, at this point, over 200 million people have received the vaccine in the United States. You'd be hard-pressed to find drugs or vaccines that have been given to that many people. and that have been so carefully studied and followed during that time. And what we've seen through countless studies, starting with the 44,000 person study that led to the emergency use authorization in the first place, and continuing with many, many more studies demonstrating safety of the vaccine, safety in pregnancy, safety in breastfeeding, safety in adolescence, safety in the immunocompromised, safety in those with allergies, the list goes on and on. And what we've learned from all of these studies, and what we continue to learn from studies that come out on a daily basis, is the vaccine is incredibly safe and incredibly effective. And still, this approval from the FDA will act as an added stamp of confidence. Confidence not only for individuals, but for healthcare entities, for businesses, for schools, and for other institutions to consider the implementation of vaccine requirements to keep their members and their community safe. So where do we go from here? What does the fall hold in store for us and the COVID outlook? I get asked this a lot, and the short answer is no one knows. No model is perfect. No one has a crystal ball. However, there are some indicators that can provide insight into the coming months. Now, on one hand, along with the fast rise of Delta, there's also a relatively fast fall, still about 2 months, but in places like the UK and India. Now, of course, we're not the UK and we're not India, and we don't know yet if that will happen here. And for that matter, we as a country have not yet hit our peak in cases or in hospitalizations or in deaths. However, there's a few reasons why we should be cautious leading into the fall with the disease burden that we're seeing right now. Now, first, we have back to school coming, and this is just not the same virus that we were dealing with a year ago. So it's yet to be seen how the Delta variant may affect children in schools and how that may in turn affect community spread. Additionally, we're coming up on cooler weather. And though the virus doesn't seem to have seasonality, transmission is much more likely when people gather indoors. And finally, we just don't have enough of the country vaccinated. Yes, we have 200 million people that have received at least one dose of the vaccine, but that leaves more than 150 million people in the country who are not yet fully vaccinated. And that is a lot of fuel for the fire that Delta is causing. So the only way out of this is through the vaccine. We're at a point with the Delta variant where you will likely either be in the group who gets the vaccine or the group who gets COVID. There will not be much in between. So please make the choice, take the step, and get vaccinated. And for the next couple of weeks, you also get $100. What better deal can you find than not only getting protected from infection, protected from hospitalization, protected from death, but also getting $100 in your pocket? Now is the time. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. Last week, the FDA approved an additional dose of the mRNA COVID-19 vaccine for immunocompromised individuals. The Milwaukee Health Department began administering additional doses last week. Shortly after, public health and medical experts from the U.S. Department of Health and Human Services released a joint statement on the plan to administer COVID-19 booster shots for all fully vaccinated individuals next month. We know there's confusion about who should seek out an additional dose. At this time, only those who are moderately to severely immunocompromised, as defined by the CDC, and who have received both doses of Pfizer or Moderna vaccine should receive an additional dose. This includes individuals receiving active cancer treatment, taking immunosuppressant medications after receiving an organ or stem cell transplant, or who have moderate to severe primary immunodeficiency or an advanced or untreated HIV infection. The Milwaukee Health Department strongly recommends contacting your primary healthcare provider for the additional dose of vaccine to ensure that you are eligible. The CDC recommends individuals receiving the same COVID-19 mRNA vaccine, whether it's Pfizer or Moderna, for their additional dose. If the vaccine product received for the first 2 doses is unavailable, the other mRNA vaccine product may be administered. The Milwaukee Health Department clinics only have the Pfizer vaccine at this time. This weekend, the Milwaukee Health Department will be at Mexican Fiesta with vaccinations for any festival attendees. The vaccination site will be open from 12 until 6 p.m. all 3 days of the festival, Friday through Sunday, inside the Children's Wisconsin Community Park area, which is located near the mid-gate of the festival grounds. In addition to the vaccination clinic at Mexican Fiesta, our vaccination team will be in the community throughout the weekend. On Saturday, August 28th, we will be at the MPS Run Back to School event at Wick Playfield from 9 until 11 a.m. At the Brentwood Church of Christ Community Day Fair from 11 a.m. until 3 p.m. At the Nextdoor Foundation's Community Cookout and Resource Fair from 12 until 2, and at Alverno College from 1:30 until 4. These vaccination sites are all free, open to the public, and available without an appointment. Additionally, everyone who receives their first dose of the COVID-19 vaccine at any of these sites, who's a Wisconsinite, will be eligible for the $100 incentive that Governor Evers announced yesterday. A full list of vaccination sites and hours can be found at milwaukee.gov/COVIDvax. The door-to-door vaccination and community mobilizer initiative continues on the north side of the city, specifically reaching communities that have the lowest vaccination rates in the city. To date, the team has administered 522 vaccinations in homes. The Milwaukee Fire Department has installed 584 smoke detectors, and the team has reached out to over 3,000 homes with information about vaccine safety and answered many questions. The community mobilizer team has also implemented a social geo-targeting campaign and peer-to-peer texting campaign, which has resulted in 62 in-home vaccinations. I would like to express my thanks, gratitude, and support to the health department vaccinators and our community partners who have worked tirelessly days, nights, and weekends to bring vaccine to events, community centers, and directly into people's homes. Vaccinating our residents is an enormous undertaking, and I cannot thank them enough for their work to protect our community. In addition, I am tremendously thankful for the partnership between my office, the Department of Employee Relations, and Mayor Barrett and his office on our effort to ensure our city workforce is vaccinated. Thank you.
Thank you, Commissioner Johnson. We'll now move into the first portion of our media Q&A. We have 3 different questions from Allison Durr with Milwaukee Journal Sentinel. I'll ask them one at a time. The first one is for Milwaukee County Executive Crowley. She asks, why is the county not implementing a vaccine mandate at this time, and what would prompt you to do so?
Great question. So we started actually having this conversation when we started seeing the Delta variant on the rise. And so we've been talking with county board supervisors, West County leaders on what this could actually look like. But we also want to continue to gather the data within the organization. And so since we've launched our Vaccinate program, which allows Milwaukee County employees to let us know their vaccination status, we've also extended that deadline, prior to the FDA approval until September 10th. And so we want to at least get the data in and look at what's happening around this community before we make a decision related to mandates. Great question.
Thank you, County Executive. Allison's next question is for Mayor Barrett. She says, how is this vaccine mandate going to be implemented, i.e. through an administrative order or a health department order? And is the Common Council involved at all?
We've been working with our Department of Employee Relations, so it'll be through that department. Obviously, the health department has been involved, and we've been in consultation with members of the Common Council throughout this.
And for Commissioner Johnson, Allison says, Alderwoman Dmitrievich has said by reviving a COVID-19 health order, given current concerns about rising cases, that the mask mandate would automatically go into effect. Why not go this route?
So the health order was written over a year ago at this point, at a very different point in time of the pandemic. And at this point, we have 50% of our population vaccinated. And the emphasis really has heavily been focused on vaccines. We really want to get more people vaccinated. Vaccination, there's a way out of this. I'm really thankful that the MPS is requiring universal masking, and so are many, if not most, or all of our private schools in the city of Milwaukee. And that's absolutely, we put out the mask advisory a few weeks ago and continue to stress the importance of masking while indoors universally, whether or not people are vaccinated.
Thank you, Commissioner. I'll direct the next question to Dr. Weston, and it's from Rose Schmidt with CBS 58. She says, DHS data shows 92% of ICU beds are in use and COVID hospitalizations are increasing. What does hospital capacity look like locally? And are you concerned about this as we continue to see numbers increasing? The second question or second portion of this question is it fair to say that because of the Delta variant, getting vaccinated and stopping the spread is more important now than at any point so far during the pandemic?
So to the first question on hospital capacity. So on one hand, here in Milwaukee County, as I mentioned, we're seeing a significant increase in hospitalizations. Just in the last 6 weeks, we've gone up about tenfold in the number of people who are hospitalized with COVID. Now that said, we also have a lot of assets in Milwaukee County that we're very lucky to have. On one hand, we have several large health systems with many hospitals with a large capacity. In addition, right when the pandemic began, all the health systems joined together to come up with surge planning, and that surge planning continues. And those meetings among health system leaders continue to this day with quite a bit of regularity to talk about how we would manage a surge and what each other's capacity is looking like. So I think we're well positioned in Milwaukee County and we have good surge plans in place should we need to. But right now, we certainly have space for patients that need care. To the second question about the urgency of vaccination, certainly I think this is a critical time for people to get vaccinated. We haven't seen these sort of case numbers, these sort of hospitalizations numbers before at a time when vaccine was widely available. Last time we saw these sort of numbers was back in January. And at that point, the vaccine was available just to a very limited population due to supply concerns. That situation is different now. The vaccine is widely available. Anybody can just walk into any drugstore, no appointment needed, no money needed, and just get the vaccine right there and then. So the vaccine is widely available, and that is one of the main things that has changed at this point. Now, I think it is worth noting, somebody who gets the vaccine right now, it does take some time to build up that immunity. And so there are other measures that are just as critical, and that includes masking, that includes distancing, and that includes being in open air as much as possible. But the vaccine will help you long into the future. If history is any teacher, we see that this is not the last variant that we're going to have. There's going to be future variants, some that may be even more concerning than this. And certainly now, if not now, then at that point, you're going to want to be vaccinated and you're going to want to be protected.
Thank you. The next question is from Mary Jo Ola with Team J4, and it's for Dr. Weston or Commissioner Johnson. She wants to know, do you believe the FDA approving Pfizer's COVID vaccine will make a difference in getting more people to get inoculated? And what are you hearing from people who are currently unvaccinated or those who are doing that outreach?
I can start here. So I think that there are probably some people who the FDA approval will sway. We certainly know there's people who have questions about the vaccine. There's people who have hesitancy to take the vaccine. And I'm sure that some of them will be swayed by this major stamp of approval by the FDA. I think the effect that it may have more than that is on institutions that are considering vaccine requirements, whether it's governments, whether it's academic institutions, businesses. I think whether it's other healthcare entities that haven't yet put a vaccine requirement in place. I think the FDA authorization is added incentive to do that, but then also can have added confidence in them pursuing that.
And I agree with Dr. Weston's comments. My only other comment would be the Kaiser Family Foundation has done research on this specifically, and if the data is about a month or two old, but they had asked unvaccinated individuals what would encourage them, or if the FDA were to fully approve the vaccine, would they get vaccinated? And around 30% said they would. So I think we are all hopeful that this will encourage people to get vaccinated who potentially were hesitant previously.
And for the mayor or commissioner, I'm seeing this question asked in several ways. Reporters are wondering, what is the percentage of City of Milwaukee employees who are not vaccinated?
I don't have an exact figure there. I will go to the next question. How many city employees will the vaccination requirement apply to? Probably in the neighborhood of 3,000 to 4,000 individuals will be required to get the vaccination. I believe that the number vaccinated is going to be well over half of those have already been vaccinated. So obviously they would not be impacted. The date by which people have to establish they've been vaccinated is going to be October 29th, if I'm not mistaken. And it goes into effect September 1st. Obviously, we want to give individuals an opportunity to get the 2 shots. So between September 1st and October 29th. Thus, the October 29th day becomes a critical day. But we want people to know that the clock starts ticking on September 1st. This applies to general city employees. By law, we are required to negotiate with those employees who have collective bargaining rights. And by and large right now, what that means is the members of the police department and the members of the fire department who are in their respective unions.
Thank you, Mayor Barrett. Another question from Jeremy Janine with Urban Milwaukee. He's just wondering, does the council need to adopt any files to put the requirement into effect?
This is a workplace rule, so it's been promulgated through the department.
Right. Next question is from Caroline Reinwald with WISN 12 for Dr. Weston. I believe you answered all of her first questions. So for Dr. Weston, seeing how COVID has swept through some schools in the southern states, do you believe it will do the same in our schools here locally?
So without a doubt, it's concerning what we've seen in many schools that have already opened, especially in southern states where disease burden is a bit higher than it is in Wisconsin. It's also concerning that we're dealing with more or less a different virus than we did a year ago when school was going back into session at that time. Now, that said, I think in-person school is important, and I think there's ways that we can accomplish that and accomplish that safely. But it means having schools put the proper layers of protection in place. It means universal masking and universal masking with high-quality masks that have a good fit, that are worn consistently and that cover the nose and the mouth and the chin. It means proper distancing between the students. It means as good ventilation as the school can have. And it means getting as many people eligible vaccinated as possible.
One final question right now is from Jason Calvi with FOX6. He's wondering for the mayor, what will it take to receive the religious or medical exemption?
Well, fortunately, we have not had to cut down the trees to build this road. There's been a number of major employers, both public and private, who have already taken the step. So we will be looking at their practices to see what would constitute a religious or medical exemption. So there'll be more news coming out on that.
All right, and Caroline Reinwald with WISN 12 has a follow-up question for Dr. Weston. She says, we've heard a lot of parents say kids recover from COVID quicker and better than adults, and therefore they don't need masks. What's your response?
I would say we're seeing a record number of children hospitalized right now in this country with COVID. It's a higher number than any other time during the pandemic. So certainly kids are affected by COVID, and there's an abundance of evidence out there that masks are extremely effective in preventing the transmission of COVID.
Okay, those are all of the questions I'm seeing in the chat at this time. So I'm going to pause. We will be transitioning over to our Spanish language portion of the briefing. So media who do not plan to attend, I'll give you a minute to jump off. We'll let our Spanish language translator jump on. I'll stop the recording and I'll let you know once we will fully transition over. So thank you, media, for joining us. And just give us 1 minute before we transition.
Everybody. Thanks.
Thank you, everyone.
Recording stopped.
All right, Patricia, are you ready?
Just 1 second.
Of course.
Just 1 second, please.
So those media outlets still on the call, Patricia will go through the talking points just shared in the English portion of our briefing. And as I noted, please feel free to send any questions and Patricia can help translate them and our principals will respond and Patricia can translate those responses as well.
1 second.
You bet.
Okay, I'm ready.
All right, go ahead.
Recording in progress.
Buenas tardes. Buenas tardes a todos. Tras el anuncio de la aprobación formal de la vacuna Pfizer por parte del FDA, en el día de ayer me gustaría compartir que a partir de ahora las vacunas COVID-19 serán obligatorias para los empleados de la ciudad de Milwaukee. Tenemos la obligación de proporcionar un lugar de trabajo seguro a todos los empleados y personas vacunadas forman parte de ello. Una persona vacunada también ayudará a proteger a los miembros del público que interactúan con los empleados, así como a las familias de los empleados de la ciudad. Esta decisión es el resultado de una revisión exhaustiva por parte del Departamento de Salud y del Departamento de Relaciones de los Empleados. Y es un nuevo requisito para los empleados en general de la ciudad a partir del 1 de septiembre. A partir de este momento, los requisitos de vacunación no se aplican a los empleados representados por los sindicatos, incluyendo los empleados de seguridad pública. Seguimos discutiendo con estos grupos de sus empleados para ver cuáles son los cambios. También existen disposiciones para los empleados que soliciten una excepción por circunstancias médicas o religiosas específicas. Los empleados no vacunados tendrán hasta el 29 de octubre para presentar una prueba de vacunación. Los empleados que no cumplan con este requisito se enfrentarán a una suspensión inicial no remunerada hasta 30 días y el incumplimiento continuo dará lugar a la suspensión del empleo. Los empleados pueden acudir a su registro de vacunación en línea en el registro de inmunización de Wisconsin encontrado en dhfswir.org y seleccionando acceso al registro público de vacunación. Los empleados de la ciudad recibirán hasta 2 horas de permiso remunerado para vacunarse. Pueden hacerlo a través de su proveedor de atención médica, una farmacia local o una de las clínicas comunitarias o móviles del Departamento de Salud de Milwaukee. El Centro de Salud del Noroeste, ubicado en la 7630 West de la Mill Road, y en el Centro de Salud del Sur, ubicado en 1639 Sur de la 23, están abiertos para las vacunas los lunes, viernes de 9 a.m. a 3 p.m., los martes y jueves de mediodía a 6 p.m. y los sábados de 9 a.m. a 1 p.m. Además, el Departamento de Salud organizará clínicas de vacunación para los empleados de la ciudad en varios lugares. Los horarios y lugares de las clínicas de vacunación se proporcionarán en los próximos días. COVID-19, métricas que están ahorita. Como cada semana, me gustaría proporcionar actualización de las métricas de COVID-19. O seguimos en la categoría de transmisión extrema por los casos de COVID-19 por 100,000 con 225 por 100. A nuestra tasa de positividad se mantiene en una categoría de transmisión sustancial baja de 9.2%. A nuestra tasa de vacunación son el 52.5% de adultos en la ciudad de Milwaukee, personas de 16 años o más están totalmente vacunados y el 57.7% de adultos han recibido al menos una dosis. Para poder aumentar estas cifras necesitamos que la gente se vacune, use cubrebocas y esté vigilante en su distancia. La vacuna es gratuita, es fácilmente de obtener, está disponible y ha demostrado ser segura, eficaz para combatir el COVID-19. Hagamos todo lo que podamos para que estas cifras vuelvan a descender y las categorías más bajas y nos protejamos unos a los otros. Gracias. Now I'm going to do Executive Crowley. Okay. Aplaudo la decisión de la ciudad de imponer la vacuna a sus empleados. Sabemos que la vacuna es la mejor herramienta que tenemos para salir de esta pandemia. Y con el aumento de casos de la variante Delta, las acciones del sector público y privado como esta están fundamentalmente para mitigar la propagación del COVID-19 en nuestra comunidad. Durante las últimas semanas he estado trabajando con nuestra junta directiva del condado y líderes del condado, incluyendo nuestro asesor principal de políticas de salud, Dr. Weston, los líderes del condado, incluyendo nuestro asesor principal, Dr. Weston, para interpretar los datos del COVID-19 y evaluar varias opciones de política para aumentar las tasas de vacunación entre nuestras fuerzas laborales, que protegen al público y a nuestro personal. Y aún no hay un mandato de vacunación para nuestros empleados del condado. No está fuera de la mesa. Estamos considerando todas las opciones. Nuestros empleados trabajan con algunas de las poblaciones más vulnerables de nuestra comunidad, que se han visto desproporcionalmente afectadas por la pandemia, por lo que la vacunación es de suma importancia para nosotros. El incentivo para la vacunación de los $100. Y quiero agregar y agradecer al gobernador Evers por anunciar ayer que estará proporcionando una tarjeta de regalo de $100 a los habitantes de Wisconsin que recibirán su primer dosis de cualquier vacuna COVID-19 de un proveedor de Wisconsin entre el 20 de agosto y el 6 de septiembre. Los residentes mayores de 12 años pueden recibir la gratificación. Para recibir esa tarjeta de regalo Visa de $100, los residentes de Wisconsin tendrán que llenar el formulario disponible en 100.wisconsin.gov. Para obtener más información sobre este programa de recompensas, visite la página de recompensas de $100 del DHS o llame al 1-844-684-1064. Hay asistencia lingüística disponible. Mandato federal de las mascarillas sobre el transporte público. Además de vacunarse, sabemos que el cubrebocas, el cubrimiento, es otra parte importante, una herramienta de mitigación, y la TSA ha ampliado recientemente un mandato federal que exige el uso de el cubrebocas en todas las redes de transporte público en Estados Unidos. Este requisito federal sustituye a cualquier política de cubrebocas local o estatal. Los pasajeros y empleados están obligados a llevar cubrebocas a bordo de todos los autobuses, trenes de pasaje, aviones comerciales y en aeropuertos, independientemente del estado de vacunación, por lo menos hasta el 18 de enero del 2022. Desde el comienzo de la pandemia del COVID-19, MCTS ha trabajado incansablemente para mantener la seguridad de los pasajeros y empleados sin dejar de ofrecer los servicios de tránsito esenciales de los que depende la comunidad. Hagamos nuestra parte para mantener a estos empleados seguros, vacunándose y siguiendo las mejores prácticas de salud, incluyendo el uso de cubrebocas mientras se usen los servicios de MCTC. Para obtener más información, visite ridemcts.com coronavirus. Ahora voy a dar la información de Dr. Weston. En primer lugar, en cuanto a nuestras cifras, actualmente estamos viendo el condado de Milwaukee una medida de 254 nuevos casos al día, alrededor de 2 muertes al día. Nuestros casos se han mantenido en una posición estable. Hemos estado en torno de los 250 casos diarios durante unas 3 semanas. No está bajando ni subiendo. Tenemos tenemos en cuenta las tendencias nacionales y la vuelta al colegio que se avecina. Debemos ser cautelosos y pensar que este puede ser una pausa momentánea en nuestro aumento de casos. Mientras tanto, las hospitalizaciones por COVID siguen aumentando, ahora con 229 personas en nuestros hospitales, nuestra cifra más alta desde medios de enero. La gran noticia, por supuesto, es el plan de aprobación de la FDA de la vacuna de COVID de Pfizer. Se trata de un paso muy importante para infundir confianza en las vacunas. Todavía escucho a menudo personas que tienen preguntas sobre la vacuna, que dudan sobre si deberían vacunarse. Miren, este momento, más de 200 millones de personas han recibido la vacuna en Estados Unidos. Sería difícil encontrar medicamentos o vacunas que hayan admitido a tantas personas y que se hayan estudiado y seguido tan cuidadosamente durante este tiempo. Y lo que hemos visto a través de innumerosos estudios, empezando por el estudio de 44,000 personas que tuvo la autorización de emergencia y continuo con muchos otros estudios que demuestra la seguridad de la vacuna en el embarazo, en la lactancia, en los adolescentes, en las personas con inmunodeficiente y los alérgicos. La lista continúa y los que hemos aprendido en todos estos estudios y seguimos aprendiendo de los estudios que salen a diario es que la vacuna es increíblemente segura, increíblemente eficaz. Sin embargo, esta aprobación de la FDA actuará como un sello de confianza adicional. Confianza no solo para los individuos, sino para los centros de salud, las empresas, las escuelas, otras instituciones. Consideran la aplicación de los requisitos de la vacuna para mantener la seguridad de los miembros de su comunidad. Entonces, ¿a dónde vamos a partir de aquí? ¿Qué depara el otoño y las perspectivas del COVID? Me preguntan esto todo el tiempo y la respuesta corta es que nadie sabe. Ningún modelo es perfecto, nadie tiene una bola de cristal. Sin embargo, hay algunos indicadores que pueden proporcionar una visión de los primeros meses. Por un lado, junto con la rápida subida del Delta, también hubo una caída relativamente rápida. Todavía unos 2 meses en lugares como el Reino Unido y en la India. Por supuesto, no somos el Reino Unido o la India y aún no sabemos si esto ocurrirá aquí. Por lo tanto, como país, aún no hemos alcanzado nuestro pico de casos, hospitalizaciones o muertes. Sin embargo, hay algunas razones por las que debemos ser cautelosos acerca del otoño, como la carga de la enfermedad que estamos viviendo. En primer lugar, se acerca la vuelta del colegio y este no es el mismo virus que enfrentamos hace un año, por lo que aún está por ver cómo la variante Delta puede afectar a los niños en las escuelas y cómo puede afectar en su propagación en la comunidad. Además, se acerca el tiempo más fresco y aún el virus no parece tener estacionalidad. La transmisión es mucho más probable cuando la gente se reúne en el interior. Por último, simplemente no tenemos un número suficiente de personas vacunadas en este país. Si tenemos unas 200,000 que han recibido al menos una dosis de vacuna, pero eso deja a más de 150 millones de personas en este país que no están completamente vacunadas. Y eso es mucho combustible para el fuego que está provocando el Delta. La única manera de salir de esto es a través de la vacunación. Estamos en un punto de la variante Delta en el que probablemente que esté el grupo que no se ha vacunado, es el grupo que recibe COVID. No hay mucho que hacer en el medio. Por favor, tome la decisión, dé el paso y vacúnese. Y durante las próximas 2 semanas conseguirá también $100. ¿Qué mejor oferta encontrarás que no solo estarás protegido de la infección y de la hospitalización o de la muerte, sino también recibir $100? Just 1 second. Okay. Ahora voy a dar lo de la comisionada de salud. La semana pasada, el FDA aprobó la dosis adicional de la vacuna COVID-19. Para personas inmunodeficientes, el Departamento de Salud de Milwaukee comenzó a administrar esta dosis el martes. Poco después, expertos médicos de salud pública del Departamento de Salud y Servicios Humanos en Estados Unidos publicaron una declaración conjunta sobre el plan para administrar las dosis de refuerzo del COVID-19 a todas las personas totalmente vacunadas el próximo mes. Sabemos que sabemos que puede haber cierta confusión en torno a que debe solicitar una dosis adicional de la vacuna COVID-19. En este momento solo debe recibir una dosis adicional aquellas personas que están gravemente inmunodeficientes según la definición de la CDC y que hayan recibido 2 dosis de vacunación Pfizer o Moderna. Esto incluye a las personas que han estado recibiendo tratamientos activos contra el cáncer, que están tomando medicamentos después de recibir un trasplante de órganos o células madres, que tienen una inmunodeficiencia primaria de Moderna o grave, una infección por VIH avanzada o no tratada. El Departamento de Salud de Milwaukee recomienda firmemente que se ponga en contacto con su proveedor de salud primario para buscar la dosis adicional de la vacuna COVID-19 para asegurarse de que es elegible en este momento. Los CDC recomiendan que las personas reciban la misma vacuna COVID-19, ya sea Pfizer o de Moderna, para su dosis adicional que recibirán para las 2 primeras dosis. Si el producto de la vacuna recibida para las 2 primeras dosis no está disponible, se puede administrar el otro producto de la vacuna COVID-19. Las instalaciones del Departamento de Salud de Milwaukee solo tienen disponible la vacuna Pfizer. Este fin de semana, el Departamento de Salud de Milwaukee estará en fiesta mexicana con vacunas para los asistentes al festival. El sitio de vacunación estará abierto desde las 12 del mediodía a las 6 p.m. los 3 días del festival, de viernes a domingo, dentro de las áreas del Parque Comunitario de los Niños de Wisconsin, ubicado cerca de la puerta central del recinto del festival. Además de la clínica de vacunación en Fiesta Mexicana, nuestro equipo de vacunación estará en la comunidad durante todo el fin de semana. El sábado 28 de agosto estaremos en el evento de MPS Run Back to School en Wiki Playfield de 9 a 11 a.m. La feria de Día de la Comunidad en la Iglesia de Cristo desde las 11 a las 3 p.m. La comida al aire libre de la Fundación Next Door y de la Feria de Recursos de 12 a 2 p.m. y en el Alverno College de 1:30 a 4 p.m. Todos estos lugares de vacunación son gratuitos. Están abiertos al público y están disponibles sin cita previa. Además, todos los que reciban su primer dosis de vacuna COVID-19 en cualquier de estos sitios será elegible para el incentivo de $100 del gobernador Evers, lo que anunció ayer. En milwaukee.gov/COVID se puede encontrar una lista completa de lugares y horarios de vacunación, la iniciativa de vacunación puerta a puerta y la movilización de la comunidad continúa en el lado norte de la ciudad, llegando específicamente a las comunidades que tienen las tasas de vacunación más bajas de la ciudad. Hasta esta fecha, el equipo ha administrado 522 vacunas a domicilio. El Departamento de Bomberos de Milwaukee ha instalado 584 detectores de humo y el equipo ha llegado a más de 3,000 hogares con información sobre la seguridad y la confianza en las vacunas. El equipo de movilización en la comunidad también ha puesto en marcha una campaña de localización social y una campaña de mensaje de texto entre compañeros que ha dado lugar a 62 solicitudes de vacunación a domicilio hasta esta fecha. Me gustaría tomar extensivamente mi gratitud y el apoyo a los vacunadores del Departamento de Salud que han estado trabajando incansablemente días, noches y fines de semana para llevar la vacuna a eventos, centros comunitarios y directamente a los hogares. Vacunar a nuestros residentes es una tarea enorme y no podría agradecer lo suficiente su trabajo para proteger la salud de nuestra comunidad. Gracias.
Gracias, Patricia. Primero, tomar agua. Y segundo, puedes leer las preguntas de mi Wisconsin. Creo que las preguntas están por Dr. Weston, Mayor Barrett y quizás Commissioner Johnson. Cuando estás lista.
Un momentito.
Dale.
Esta pregunta es de Alejandro para el Dr. Weston. ¿Hay algún tipo de reporte sobre una nueva variante? Is there a report about the new variants?
So there's a number of new variants that we're seeing. Certainly the Delta variant is the one that's affecting us most right now. That's more than 98% of the virus that we're seeing in the United States. There are certainly other variants that we look at around the world. One that has gained attention is the Lambda variant. That's been quite prevalent in Peru and causing a lot of problems there. It's just starting in the United States, so it's yet to see how that will affect us. But certainly there's other variants that are quite concerning out there as well.
Claro que hay variantes. La que hemos visto más es la variante del Delta y también, what was the one from Peru? I'm sorry, what was the name?
Lambda.
También una variante Lambda que fue específicamente en Perú y hemos visto algunos casos aquí en Estados Unidos. The question is for Tom Barrett from Alejandro also. Mayor Barrett, do you consider it was a mistake to remove the mask mandate?
No fue un error. Cuando eliminamos el requisito de máscara, los números eran bajos y la gente estaba recibiendo la vacunación. Esto es muy importante. Obviamente, la variante Delta cambió todo. If that made any sense, Patricia.
Yes, it did. ¿Tiene alguna pregunta, Alejandro? ¿Le contestó bien el alcalde? Puede poner en el chat. Okay, so the second part is not wearing a mask is at fault for the new infections.
Well, we obviously want to have everyone wear the mask. We think it's important for everyone to wear the mask. But we really believe that the vaccination is effective.
Claro que queremos que todos se pongan el cubrebocas, pero creemos y es muy importante que todos se pongan la vacuna. So es otra pregunta de Alejandro. Okay. Muchos de los hispanos que no quieren vacunarse porque tienen miedo a los síntomas posteriores a la vacunación, pues muchos de ellos no tienen seguro de salud. Okay, a lot of the Hispanic are afraid of the vaccination because of the symptoms after the vaccination. And a lot of them do not have health insurance to cover the medical expenses. How could we convince them? How could we convince them to go get vaccinated and to not be afraid of the vaccine?
So I'm happy to start here. I'll do it in a sentence or two at a time to help maybe with interpretation. So this is a very common question that comes up, especially among people who have trouble getting time off from their job and have trouble calling in sick from their job.
Esta es una pregunta muy común, especialmente para las personas que tienen un poco de dificultad para sacar tiempo fuera de su trabajo.
What I would say is two things. One is you have to consider the risk benefit of getting vaccinated versus not getting vaccinated.
Lo que yo recomendaría es ver el factor de riesgo en vacunarse y no vacunarse.
People who get vaccinated usually have one of three effects. Either they have no side effects from the vaccine, they have a little bit of a sore arm, that's very common, that's what I had from the vaccine, or they have flu-like symptoms, body aches, fatigue, that last about 24 hours.
Hay tres posibilidades de resultados de la vacunación. Uno puede ser que solamente que no tenga ningún resultado, que se sienta bien, ningún síntoma. Segundo, que le duele el hombro un poco. Y el tercero, que pueda tener síntomas como que si tienen la gripe, simple y sencillamente.
When looking at the 200 million people who've received the vaccine, side effects aside from that are very rare. Despite what you may hear on social media and elsewhere, other side effects are extremely rare.
Estamos viendo el resultado de 200 millones de personas que ya se vacunaron. Los resultados son muy, muy raros. Otros resultados que tú puedes estar viendo en las redes sociales.
And when we talk about risk benefits, you have to contrast that with getting the COVID infection, which at this point, if you don't get vaccinated, the chances of you getting the infection at some point are pretty much close to 100%.
Y podemos ver que los resultados de vacunarse y no vacunarse, si no se vacuna y reciben el virus, los riesgos son mucho más altos. Así es que tenemos que tener una balanza.
And if you do get infected, you have a very good chance of getting sick. Even if you're at home sick, we're talking being out of work for 3, 4, 5 days, maybe a week or more.
Y si te infectas, puedes estar fuera del trabajo 5 días, 1, 2, 3, 4, 5 días, dependiendo de tu reacción, y vas a estar fuera del trabajo.
In addition, you have about a 10% chance of getting hospitalized, and unfortunately, still a 1% chance of dying from COVID.
Y desafortunadamente también tienes 10% de estar hospitalizado y, ¿was it 1%?
10% of hospitalization, 1% of death.
10% de hospitalización y 1% de muerte.
And even if you're otherwise healthy, you may not end up in the hospital, but you have about a 25% chance of having long-term symptoms from your COVID infection, long-term fatigue, long-term pain, long-term shortness of breath.
Y las consecuencias del COVID, de no estar vacunado, es que es a largo tiempo. El cansancio y diferentes otros riesgos por no vacunarse con el efecto del COVID.
So considering all that, the benefits from the vaccine don't even compare to the risks of not getting vaccinated.
Considerando todo esto, los riesgos, no hay ninguna comparación de vacunarse y no vacunarse.
But I understand people have difficult job situations. And for those folks, I would recommend, if possible, get the vaccine before your day off. The chances are that you'll have no side effects. Chances are that you'll be just fine. You'll be able to go about your day as normal. But that's a safe way to make sure that if you do feel under the weather, if you do need to rest, you have that day to do it.
Mi recomendación es que se vacunen antes del día de que van a tener un día libre. Así pueden descansar si les dan los síntomas y estarán seguros de la vacunación. I'm just going to read the second part of that he posted. Alejandro's comment es, el problema es el miedo a que se enfermen por la vacuna posteriormente. So the problem is the fear of getting sick after the vaccination.
Right. So I would say very few people get sick, severely sick after the vaccination. It just doesn't really happen very much at all. The typical, if you're going to get sick, it's going to be about 24 hours of feeling under the weather.
Muy poco porcentaje de personas se enferman después de la vacuna y si se enferman es solamente 24 horas que te vas a sentir un poquito enfermo como si tuvieras la gripe. Alejandro, ¿alguna otra pregunta?
I believe County Executive Crowley had a talking point too, if you wanted to jump in, and then we'll wrap up. I think people are have meetings they've got to run to.
Well, thank you and good to see you, Patricia. I wanted to talk about that there is an incentive for employers to take advantage of if somebody gets the shot and ends up getting sick.
O sea, hay un incentivo para las personas que se ponen la vacuna y se enferman.
So President Biden did offer paid time leave for anybody who received the COVID-19 vaccination and ends up getting sick. But it is up to I'll let you go.
El presidente Biden sí dio recursos para los empleadores para que si un empleado se pone la vacuna y se enferma, pueden pagarle.
So if you own a business or employee and is afraid of losing hours, your employer can apply for a tax credit that will be given to that business for giving you paid time off because of as a result of receiving the vaccine and getting sick, or if you need that time off to recover.
Si tú eres dueño de negocio o si tu empleador te tiene que pagar porque tú estás perdiendo trabajo por enfermarte por la vacuna, pueden solicitar un crédito de la vacunación para poderte pagar. Thank you. Gracias.
I know we're over time. One quick item I'd add is
Voy a agregar una cosa más.
it's important to note that you don't have to pay anything for the vaccine. Your immigration status does not matter to get the vaccine. Today, this afternoon, you can walk into any drugstore and just ask for the vaccine, no appointment needed, and you can get it right there.
Otra cosa que quiero agregar es que la vacunación es completamente gratuita, no importa tu estatus migratorio, no importa nada, tú solamente vas a un centro de vacunación o a una farmacia y puedes vacunarte.
Bueno, gracias a todos. Ya terminamos por hoy y nos vemos la próxima semana. Gracias.
Gracias.
Thank you. Gracias.
Thank you.